This is a very interesting topic that you're going to hear more about. And I first heard about it April a year ago when I was in Boston as part of the Harvard Nutrition Roundtable and heard Dr. Walter Willett, who is the second most frequently cited scientist in the world, give a talk about vitamin D deficiency and how we're in the throes of an epidemic. Now, to put things in perspective, Dr. Willett at Harvard, who's the head of nutrition there, is the one that got trans fats on the radar screen. So he's, in nutrition circles, is very well thought of. He happens to be a personal friend of my sister who was in the health food business in Boston for a number of years, kind of one of the pioneers in the whole health food business. Since I learned about this, we've been checking vitamin D levels in our patients, and I would say 90+% are deficient. And when you replace the vitamin D, the results are pretty profound. Vitamin D deficiency now has been associated with 16 different types of cancer, cardiovascular disease, diabetes, multiple sclerosis. We've known for years that as you move away from the equator, as you move further north, there's a higher incidence of multiple sclerosis. And a lot of people feel now that it is the result of a lack of vitamin D because most of your vitamin D actually comes from the sun. And so as you move further north, you generally have less sun exposure. I think we were designed to run around in a loincloth around the Caribbean and not live in these northern latitudes. This is from the Life Extension Foundation magazine. It was their cover story, picture of President Bush, and the title was, "Should the President Declare a National Emergency?" Should he declare a national emergency about this vitamin D deficiency epidemic and take out public service announcements and encourage everyone to go get their vitamin D level checked? If I were the Surgeon General and I could do one blood test on everyone in the United States, it would be vitamin D levels. So your fish, a fish is great. I mean, wild fish is a great source of omega-3s and vitamin D. If you look at the Eskimos, they don't have a vitamin D deficiency problem because they eat a lot of oily fish. And it was really the epidemiological studies looking at the Eskimos and their low risk of cardiovascular disease, despite the fact that they were overweight, that led to the research regarding all the benefits of omega-3 fatty acids, but it's gone well beyond just cardiovascular disease. So omega-3s and vitamin D are two things that you really want to make sure that you're getting an adequate intake of. Now here are some things, kind of special blood testing. Everybody gets their routine tests, cholesterol and so forth, but here are some things that I test more frequently probably than most, and we already talked about vitamin D. And quite frankly, it's rare we find somebody that has a normal level. Hormone levels, you'll hear a lot about now about hormone balancing. And one of the things that we're seeing, particularly in men, is low testosterone levels. And I think there's several reasons for that. But if I have an overweight male and his testosterone level's low, he's beating his head against the wall trying to lose weight. Testosterone is very important for the conversion of what we call a stem cell, not the stem cell you're thinking of, but cells kind of go down different paths. There's one cell that either goes towards fat or muscle, the same cell. Under the influence of testosterone, it goes to muscle, so you're creating muscle cells. So if your testosterone's low, then you're creating more fat cells. In women, you can, postmenopausal women, you can balance their hormones using bioidentical hormones, which are really the natural hormones that your ovaries would make if they were still working. But the other thing that we check for, not infrequently, is gluten or wheat sensitivity. With my interest in irritable bowel syndrome, you see a lot of patients that have digestive complaints, and it turns out it's a sensitivity to gluten. They used to say that gluten sensitivity occurred about 1 in 3,000 people. Now they're saying it's probably closer to 1 in 100. Some people feel it's even a lot more common than that. We could all do without gluten for the most part. Not that everybody's sensitive, but you'll see more and more gluten-free. You probably noticed that in the supermarket, gluten-free, gluten-free. And that's because of this increased awareness of how common gluten sensitivity is. And if you can think back to the slide I showed you with the good and the bad bacteria, if you're gluten sensitive, it damages the small intestine and causes that same sort of leaky gut that you get when you don't have the right bacteria. And anytime you have damage to the lining of the intestine, the small intestine, which should be a selective filter, you're going to get activation of your immune system. And there's a lot of overlap between gluten sensitivity and a lot of the so-called autoimmune disorders like lupus and rheumatoid arthritis and so forth. It's interesting, when I wrote my first book on irritable bowel syndrome in 1989, I wasn't as aware of this. And I had a chapter in there which was basically an elimination diet that you could follow if you had irritable bowel syndrome to see if there was some food that you were reacting to. And it was a very restrictive diet. One of the things that was not on the list was gluten. And I got 2 letters within a month of patients that said, read your book, liked it. Not only did my IBS get better, but my rheumatoid arthritis got better. And I'm not here to say that everybody with rheumatoid arthritis has a gluten sensitivity, but it's something